I'd like to start by thanking everyone for being here today. As you will hear from the following healthcare facts, America's healthcare system is in a horrible state. But here today, our healthcare crisis has a prayer. It is exactly your faith and dedication to a progressive solution that our country needs to push positive healthcare reform through at the federal level. We live in a country where 47 million, or over 15% of the population, goes every day without any form of health insurance. And of those Americans who do have some form of insurance, 100 million are considered underinsured.
In Illinois, this is a crisis for our poor and our working families. Of the 1.8 million uninsured residents in our state, 66% are employed or from working families. Illinoisans who work hard to keep our state running cannot afford to go to the doctor when they get sick.
The people who live in this country are simply being priced out of the system. 1 out of every 4 people say that their family has had problems paying for medical care in the past year. The average family now spends about $12,000 per year on insurance. And every 30 seconds, someone files for bankruptcy from having too much medical debt. A new report from the Robert Wood Johnson Foundation yesterday shows that from 2001 to 2005, health insurance premiums have increased 19.5% for Iowa families that receive their health care from their employer, while the average income for those families in that same amount of time has actually dropped 1/3.
Not only is healthcare unfairly expensive, but a lack of insurance can have dire consequences. Uninsured individuals, unable to access preventative or diagnostic care, are sicker and die sooner than their insured neighbors. Nationwide, 18,000 people die every year due to a lack of health insurance. In Illinois, this translates to more than 18 people per week. These individuals are our family members, our neighbors, and our friends. They sit next to us in church, and they shop with us at the grocery store. And when they get sick, they may have to choose whether they can afford to see a doctor or to keep their house that month. These statistics are scary, and they highlight a systematic failure to take care of our friends, neighbors, and the sickest and poorest among us. But they must serve as a wake-up call to all of us to work hard for justice in our states and in our nation.
So what are we doing to change the course of this healthcare system? Well, thanks to years of demand from Iowa's healthcare voters and groups like Iowa for Healthcare, late last week, the Iowa legislature passed a monumental healthcare reform bill that will bring coverage to Iowa's 50,000 uninsured children by 2011. This bill will also require insurance companies to accept young adults through their parents' health insurance plans until they are 25. This will make a world of difference for the young adults, considering that the age group from 18 to 25 is the largest and fastest growing uninsured demographic in this country at nearly 30% uninsured. Iowa has accomplished quite a bit this past year for healthcare reform, but we aren't there yet. We need change at a federal level, and that change can only come with the support of concerned voters like yourself who are feeling the pinch of our broken healthcare system every day.
The progress made on behalf of children and young adults in Iowa is exciting and encouraging. In Illinois, a grassroots coalition of healthcare advocates and consumers is also working with state legislators to pass meaningful reform. Over the next few months, we need your help to make it happen. We can no longer stand idly by and wait for our state leaders to enact the change that we need. As we offer up our prayers for healthcare justice, we must also provide pressure on our legislators to act now. Please, if you have a healthcare story, tell it. Use your voice. Let your legislators know why we need healthcare reform. Get involved with the work of Iowa for Healthcare or the Illinois Campaign for Better Healthcare. Help us lay the groundwork for accessible, affordable, quality healthcare for everyone in Illinois, Iowa, and our nation.